Welcome to Infinite Training. I'm Steve, and I wanted to talk a little bit today about shoulder pain, which is the third most common cause of pain in people. So I need somebody. Oh, hey Lucas, are you busy?
Kind of, but what's up?
I need somebody to help me show some shoulder tests. Are you willing and available?
Sure, no problem.
All right, thanks. We got Lucas here. Very good. So we'll start with 3 tests standing. One is called a near impingement test. So basically, don't have to change. You have your client, or if you want to test it out on yourself, you have them turn their arm in, keep their elbow straight, and then you guide them. They do the motion, keeping their elbow turned in the whole time and straight. Bring it over their head as far as they can. And at any point, there's pain?
Nope.
No pain. So that's the near impingement test. If there's pain, there's a possibility of the client having impingement syndrome. Second test, keeping the arm at 90 degrees, flexion, bending, and then you have them turn their wrists, go towards the floor, and you give a little bit of extra pressure. That's the Hawkins-Kennedy test. Is there any pain?
Discomfort.
So that's a positive test, and the painful arc can be done 2 ways. It can be done in the scapular plane, so the scapula lies about 20 degrees, not to the thorax, so you can go in the scapular plane, keep their elbow straightened, and ask them to reach with their arm all the way over their head. That's in the scapular plane. If there's pain, it's a positive test. Come back out. And then you can do in the frontal plane. They're just more in line with their thorax, and do the same test. Just really to tease it out. Any pain?
Nope.
Okay. Just tightness.
Just like this.
So 3 simple tests that you can do just to make sure that your client might have pain. It gives you a starting point. So when looking at your shoulder, there's many different ranges of motion that we can take a peek at. The most important is that you do a comparative analysis for both sides. So if you're checking the right because they might have right shoulder pain, these range of motion tests you want to check on the left also to see if there's a equilibrium, where is there the least range of motion, and then you go by that. So starting with a straight arm internal rotation, you keep in mind where it's at, and you go to straight arm external rotation. And have your client do it actively. You can use your hands to support the elbow to keep it straight and guide them along. Just doing a abduction, looking at, don't help please, just finding out where their range of motion is. If at one point the shoulder starts to come up, that's the end of the range of motion. And then you would compare it to the other side. One of the key things about that is you have your deltoid, and then you've got your rotator cuff muscles that could be causing a problem underneath, which might limit that range of motion. You also want to check internal rotation at a 90-degree angle at the elbow, and external rotation. Again, if you're doing these tests, you want to make sure that your client is not experiencing any pain. And the last one, keeping the arm straight and just bringing your arm all the way over your head. And come out of that. Using those range of motion tests will show you where the limitation is, and then you can start to decide where you want to work with this client. Thank you.